Today I'm going to show you how to use and get the best results possible with the Wicked White Professional Teeth Whitening System. My name is Nicole Kiley and I am a registered dental hygienist. I have been using Wicked White Professional Teeth Whitening products for about 6 years now. My team and I have actually brightened thousands of smiles using this system. We love it because it's cost-effective, easy to use, customizable, and we consistently get our patients great results with minimal to no sensitivity. Wicked White is a Canadian-based company that was founded by a former registered dental hygienist. The professional products in this line that you need for in-office whitening are only sold directly to dental professionals. So one of the things I love the most about this system is that it does not require a gingival barrier or expensive patient kits like some of the other companies. If you're a dental professional and you've been in the market for a new system for your practice, you may have come across products that are similarly packaged. There is no other distributor or company that is selling these exact gels.
These proprietary blends are vegan, cruelty-free, gluten-free, natural, and have no additives or preservatives.
I genuinely want you to get as excited about whitening as we are, and I cannot wait to show you how to use these amazing products on an actual patient. So let's get started.
You can purchase everything you need directly from the Wicked White website. Simply go set up your professional account and start browsing. The light required for this system is available for purchase on Amazon. Please note that the prices shown on the website could change. We like to include an exam kit along with scalers. You'll need the 2 whitening gels, hydrogen peroxide and carbamide peroxide, applicators and micro brushes, Dappen dishes, gauze, vitamin E oil, lip balm, a cheek retractor, and the Wicked White pre-treatment spray. Other products that you may want to stock include the Wicked White Remineralizing Gel to help prevent and manage sensitivity, the Wicked White Tooth Gloss to help repel stain after a whitening treatment and can also be used at home, the optional curable gingival barrier, and the at-home Wicked White Extender Pen to help your patients extend and maintain their results at home. Let's talk about the protocols. One thing that I really like about the Wicked White system is that you can adjust the protocol based on your patient's needs. You'll apply hydrogen peroxide gel along with light-activated carbamide peroxide gel to gradually lighten the teeth. It's important to note that no matter which protocol you follow, you need to start with hydrogen peroxide and finish with carbamide peroxide. Let's review the standard protocol and the enhanced protocol. The difference between the two is the amount of times that you'll apply the gel in one appointment. Standard protocol is great for somebody who has previously whitened their teeth, has a brighter starting shade, a history of sensitivity, or an option for maintaining their new brighter shade. You're going to do 2 applications of hydrogen peroxide followed by a 20-minute application of carbamide peroxide. At the end of each application, the gel will be depleted and needs to be rinsed off and reapplied. The enhanced protocol is best for somebody who has never brightened their teeth before, has a darker starting shade, or a patient who wants the most dramatic results possible. The enhanced protocol has 2 15-minute applications of hydrogen peroxide, followed by 2 15-minute applications of the light-activated carbamide peroxide. Some clinicians like to take either a photo before they start whitening or use a shade guide to track the shade. Just a heads up, it's really difficult to capture the true shade of teeth in a photo. Good retraction is really important for keeping your patient comfortable. You can purchase 2 different sizes of cheek retractors directly from the Wicked White website. We like to apply some lip balm before inserting the retractor. Simply squeeze the two C-shaped pieces of plastic together. The longer blue piece in the middle is meant to be a tongue retractor. Based on your patient's anatomy, they may be more comfortable with the longer portion pointing upwards. Insert the retractor into each side of the cheek and ask your patient to bite down. You'll also want to cleanse the surface of the tooth before you get started to make sure you get the best results possible. Use the Wicked White pre-treatment spray to remove any layer of material off of the teeth. After you spray it on, use a microbrush or a cotton tip applicator to scrub the product in. Rinsing at this stage is optional. Teeth dry pretty quickly, but you may want to use a little air to get the rest of the residue off. As I mentioned earlier, you do not need to use a light-cured barrier with this system, but you will need to protect the gingiva. Wicked White recommends using vitamin E oil to prevent the gel from touching and irritating the gingiva. You can purchase pre-loaded swabs directly from the Wicked White website. Simply crack the top of the swab and let the product drain down to the cotton. Alternatively, you can buy vitamin E oil in bulk, dispense it into a dappen dish, and use a microbrush. If you prefer to use a light-cured gingival barrier, you can also purchase that directly from Wicked White. Simply apply the gel to the gum line. We like to use a microbrush to drag the product down into the papilla. You'll then use the whitening light to cure the product. It takes about 30 seconds. Next, you're going to dispense about 1/4 ml of hydrogen peroxide gel. It's about the size of 2 green peas. You may require more product, but generally we recommend that you dispense too little rather than too much. The hydrogen gel has a smooth consistency. We like to use these wooden cotton-tipped applicators to apply the gel to the surface of the teeth. As with all professional teeth whitening systems, you'll whiten the teeth visible when the person smiles. Generally, it's from 5 to 5. You'll leave the gel on the teeth undisturbed for 15 minutes. We like to use a wet gauze to remove most of the gel and then rinse the rest with the air water syringe. If either of the whitening gels get on the gums, it may cause some irritation. Your patient may describe a tingly feeling. If so, wipe the gel off and apply vitamin E oil to the area. It's not uncommon for gums to blanch if the gel touches them. You can generally expect the blanching to dissipate after about 5 minutes. After 2 rounds of hydrogen peroxide, you'll then apply the light-activated carbamide peroxide. Dispense about 1/4 milliliter of gel into a dappen dish. This proprietary blend of carbamide peroxide has photoinitiators in it that use pressure, fluid, and light to accelerate the whitening process. You'll notice that the consistency is a lot thicker than the hydrogen peroxide on account of the encapsulated beads that need to be broken up during the whitening process. For this reason, this gel is applied a little differently than the hydrogen peroxide. After reapplying vitamin E oil to the gum line, you're going to start by hydrating the surface of the tooth with water on a microbrush. Use a microbrush or cotton tip applicator to agitate the gel and burnish it into the tooth as you're applying it. This is an important step for activating the gel. Continue to burnish it onto the surface of the tooth. Position the whitening light over the teeth. At the 5-minute mark, you'll return to your patient and apply a little more gel, using your applicator to burnish it into the surface of the tooth. Continue to whiten based on the protocol you're following. You'll then clean the gel off of the teeth. You can gently remove the barrier using an explorer or the end of an applicator. If your patient is using a teeth whitening product more than 3 times a year, you may want to recommend that they also use the Wicked White Remineralization Gel. You can apply it immediately after a treatment before removing the cheek retractor. Simply dispense the gel and apply it directly to the surface of the teeth. Let it sit undisturbed for 5 minutes and then rinse it off. Alternatively, you may want to protect the teeth from surface staining. Wicked White tooth gloss can be applied immediately after whitening and it repels stains for 20 to 30 minutes. This gel can also be used at home. It makes teeth appear brighter by helping light reflect off the surface. Apply it with a cotton swab or your finger immediately after the whitening treatment. To remove the retractor, simply pinch the 2 C-shaped pieces of plastic together and remove it from your patient's mouth. If you took a shade in the beginning, you can take one now to compare. As with all professional teeth whitening systems, results can vary from person to person. After an in-office whitening treatment, you'll instruct your patient to avoid eating, drinking, or smoking for 30 minutes. They should also avoid drinking anything that could stain a white t-shirt for 24 hours. That could include things like red wine or black coffee.
Here are some tips for making the most of the Wicked White Professional Teeth Whitening System.
You'll likely find that some people's teeth are more difficult to brighten than others. If their teeth are more dark in color, you can let them know that they may benefit from multiple appointments to get desired results. Results are buildable, and you will find that once somebody has brightened once, they tend to get more dramatic results at the next application. No matter how bright their smile gets, you will need to discuss a maintenance plan with them. This could mean coming in once or twice a year and having a full protocol completed, a creative option like a 20-minute dental cleaning add-on, or a product they can use at home. The Wicked White Extender Pen is a great way for your patient to maintain their brighter shade at home. This product is super easy to use, and it can be used alone or along with custom fit trays. Simply turn the bottom dial of the pen and advance the product onto the bristles. Lift lips off teeth and apply a thin layer of product, being mindful of the gum line. Once the product is applied, you can either instruct your patient to insert their custom fit trays for 30 minutes or leave lips off teeth for 30 seconds and then spit out the excess. Wicked White recommends using the extender pen before bed to avoid staining from foods and drinks. The Wicked White Advanced Professional LED at-home whitening kit can be used to brighten your patient's smile at home. It's also a great option for maintaining their new brighter shade. You may want to consider adding an extender pen or a take-home whitening kit into the cost of your protocols. One of our favorite ways to help our patients either maintain their new brighter shade or to gradually brighten over time is to give them the option to add a 20-minute whitening treatment onto their dental hygiene visit. We find that after scaling, we get the best results possible with teeth whitening in the shortest amount of time. Skip traditional prophy paste to avoid putting a layer of oils or other ingredients that may affect the results of teeth whitening. Instead, you can use some pumice or the Wicked White Activated Charcoal Gel.
If you have any questions, feel free to email them directly at the address below.